Hello. So in this video, I want to talk a little bit about why alcohol is not a good strategy for coping with stress. Stay tuned. Welcome to Wellness with John. I'm John Peters, and these are resources to help you thrive. So if you've been watching my channel, you know that I'm a therapist and I've been in practice for over 26 years, working with thousands of patients with a wide variety of issues. And in this video, I want to talk a little bit about why alcohol is a bad idea to use it as a coping mechanism for high levels of stress. And one of the reasons I bring this up is that it's a common issue. So it's common for people to drink. A lot of people, about 1 in 10 people in the United States, actually drink regularly and somewhat heavily. In fact, 1 in 10 drink heavily enough that they meet the criteria for alcohol abuse or alcohol dependence, right? That's in drinkers, not 10% of the American population. But it's an issue for a lot of people. And this is why we therapists often ask people in the first session, how much do you drink? How do you use any drugs and things like that when we're doing our psychosocial assessment to try to figure out what's going on with someone. And what I find is that people often do use alcohol as a coping mechanism, and it's often an important thing it's an important thing to address, not only because it's not effective, and I'm going to tell you why, and it has risks and costs, and I'm going to explain that, but also it can be its own issue. So sometimes when, for example, we have a patient who is depressed and they are drinking heavily, we can't really do the things that we normally would do with a depressed patient in order to ameliorate their depression until we reduce the person's drinking, because the drinking is actually going to make it worse. And I'll come back around to that issue later as well, right? But let me put it this way. Alcohol actually is a stress reliever. Let's just get that out there. If you occasionally have a stressful day, and you infrequently, but occasionally will have a beer or two, let's say, to relax, that's actually not a big problem, because alcohol actually does suppress the nervous system and it kind of mildly sedates you. And its action is actually in the body in terms of the biochemistry. It's similar to why people take Xanax and Ativan, right? But the benzodiazepines, like Xanax and Ativan, they just suppress the stress response, which is why it's relieving for people who have acute stress, like panic attacks. But the problem, and this is a problem with those benzodiazepines too, but the problem with alcohol is that most people aren't using it for an occasional bad day and using just a little bit. Most people are using alcohol at the point where I talk with them because they've been going through a prolonged chronic period of stress, right? Because the reality is that people don't have a bad day and then decide to go to a therapist because of a bad day, typically. Usually if people show up at therapy, it's because they've been having months of bad days every day in a row, and they're not coping well with it, and it's making them too miserable, right? So the thing is, unlike an occasional drink after an occasional bad day, what happens is that people are having day after day after day after day of a bad time. And if their thing that they're going to try to cope with that is alcohol, that's not going to work. And the reason it doesn't work is because of how the body reacts to alcohol. So the problem is that when we take in a substance that changes our functioning, our body has this tendency to try to stabilize and counteract the effect of whatever that is in order to achieve what we call homeostasis. And so what happens is, if you're drinking not just occasionally, but you drink every single day, your body is experiencing this sedation. And what your body is going to do is counteract the sedation by overproducing these chemicals in your body that basically wake you up, right? This is why if you have a friend or a family member, someone you know, who is a heavy drinker and they've been drinking for a really long time, they can drink a huge amount of alcohol and still look like they're functional, right? And if you had a non-drinker who in a single session drank the amount that the experienced drinker were to drink, it might even be a fatal overdose for them, right? So people who drink regularly build up so-called tolerance. And what is tolerance? Tolerance means I can tolerate more alcohol coming in because my body is going to counteract the amount of alcohol that is coming in, right? And how do we counteract that? We overproduce stress hormones. So this is one reason that alcohol use for a chronic stressor is a bad idea, because when you regularly drink, as in daily, your body is going to adjust to that and actually produce more stress hormones. So you're going to end up being as stressed or more stressed than where you started. And if alcohol is your go-to, the only way to overcome that is to drink more alcohol. And that's why people who are going through a prolonged period, and I see this with people going through divorce, people with job dissatisfaction, people, caretakers of parents with dementia and things like that. When you have this chronic stress that's going on for months and months and months, and people are drinking to try to control the subjective misery of the stress, they have to keep upping the amount of alcohol that they drink. And I've seen people up that to dangerous levels. In fact, when I used to work inpatient as the social worker for a critical care unit in a hospital, we saw many, many people come in and die because they had just toxified their body. They killed their liver. They had poisoned themselves with these heroic doses, like half a gallon of vodka a day. They didn't start off drinking a half a gallon of vodka. They started drinking a couple shots when, let's say, their divorce started happening. And that couple shots turned into 5 or 6, and that turned into 10, and it eventually got to a fifth or a half a gallon of liquor a day in order to try to get the same stress relief that they got from the 1 or 2 shots at the beginning, right? Again, if they had had one bad day and they had 1 or 2 shots, no big deal. But they didn't just have a bad day, they were having a bad year. And so, Monday turned into Tuesday, turned into Wednesday, turned into Thursday. Every single day was stressful. And the person was reaching for alcohol in order to counteract the stress. But the body was saying, we don't want to be that sedated. And so we're going to just produce more stress to counteract what the alcohol is doing to reduce the stress, right? See where we're going with this? It's a strategy that backfires pretty quickly if you use alcohol to try to cope with a chronic stressor, right? Now, again, a low to moderate amount of alcohol infrequently isn't going to produce this effect, because your body isn't going to produce a whole bunch of stress hormones if you have 1 or 2 beers once a week or so, right? But if you have 1 or 2 beers every single day, that's going to turn into 2 or 3. That's going to turn into 3 or 4. That's going to turn into 4 or 5, right? And if this has happened to you, you know exactly what I'm talking about. And the reality is that as you build up, you're really only getting the mild, small amount of stress relief from the larger and larger dose that you got from the initial dose in the beginning. And the reason for this is that your body is adjusting to the alcohol and it's basically pushing back, right? Now, this is bad for multiple reasons. One is that there's really no end to that process unless you die, right? That there's no plateau where your body says, okay, 7 beers is really enough and that's really going to work for us. Because if you're drinking 7 every day, that's going to become 8. That's going to become 9. And why is it going to increase? Because your body is going to say, wait, I'm just too sedated. I'm going to push back by producing too much or an overproduction of stress hormones in order to stay awake and not be too sedated, right? And so this is why an experienced drinker can drink, 12 beers, where a novice or a non-drinker would pass out with 12 beers or be thrown up, right? Or whatever, like your body adjusts to alcohol. That's the reality. And so alcohol doesn't work to reduce stress because your body will basically increase the chemical type of stress response in order to keep you awake because alcohol is sedating. That's the core of the problem. Now, obviously, it becomes a bigger problem once a person is drinking so much that they're putting themselves at risk of just not functioning because of the level of alcohol that they're drinking, right? So it diminishes a person's ability to work, to be a productive member of the community, to be a functional family member, and to get proper nutrition. And, higher levels of regular alcohol use become actually dangerously risky in terms of health and functioning. And also it puts others at risk. If someone's out there driving drunk, they could cause an accident to cause injury or fatalities, right, or property damage. People make bad decisions while drunk that they don't make when they're sober, right? And that could have financial consequences for a person, or it could have relationship consequences. So higher levels of alcohol use become increasingly risky and costly and toxic and potentially fatal. I used to work in a critical care department, and I would see people come in and die from drinking a half a gallon of vodka a day. And why did they drink a half a gallon of vodka? Not because they woke up one day and had a bad day and started drinking a half a gallon of vodka. It was because they were going through a divorce or something, and it was stressful and they couldn't cope. And so they were reaching for 1 or 2 shots, and 1 or 2 shots turned into 2 or 3, and 3 or 4, and 4 or 5, and so on until they got to drinking a half a gallon of vodka a day, right? So alcohol doesn't work for stress because our body is going to respond by producing the chemical stress response in order to counteract it, which means you're chasing something you can't get to. And it also means that the very reason that you tried to reach for alcohol to calm yourself down and reverse your stress response is actually producing more stress. Because the reality is, heavy drinkers are more stressed than non-drinkers, right? If alcohol worked as an efficient, acceptable way to reduce stress, then we ought to see less stress in drinkers, but we don't. We see more stress. So if your goal is to be less stressed, you need to think very carefully about whether you're using alcohol at times and whether you're keeping that at a very low level. And what you need to do is come up with other strategies that aren't risky and costly, that aren't alcohol use or drug use, in order to deal with your stress, right? And the good news is there are lots of things to do with that. But the other caveat is that alcohol induces other psychiatric issues like depression and anxiety. And so this is why we therapists address the alcohol issue, because if you are depressed and you're drinking a 12-pack of beers a day, I can't treat your depression until you lower your alcohol use, because alcohol is a depressant. So not only is it making you more stressed, it's making you more depressed. And if I try to pretend that it doesn't matter and treat you for depression while you're drinking that much, it's absolutely not going to work. That would be unethical, right? And this is why we therapists push people to assess their alcohol and drug use and to take care of that first, often when they have another coexisting issue like anxiety or like depression, right? So it actually can induce another psychiatric issue, and it can exacerbate it, and it can prevent the resolution of the other issue if you don't address the alcohol use, because it's going to prevent that therapy from working, basically. So now I will say that if you are a heavy regular drinker and you're concerned about whether or not you might have a withdrawal syndrome when you reduce your alcohol use, it is very prudent to talk with your doctor about your plan to reduce your drinking, because doctors can sometimes guide people on how to reduce their drinking in a safe way. Occasionally, they will prescribe medications that will cover some of the withdrawal symptoms so that you stay out of the dangerous category. But if you stop drinking and you have a withdrawal syndrome, talk to your doctor. If you're having acute symptoms that you're worried about, go to the emergency department, because the reality is that withdrawal actually can be medically dangerous, right? You know the Grateful Dead band, right? And Jerry Garcia, the lead singer and guitarist, he died from withdrawal, right? So he was using opiates, I believe, and he went into treatment for that, and he stopped, and he actually died from the withdrawal syndrome. He didn't die of a drug overdose, right? So you have to take this seriously if you're using high enough uses that when you lower it or you skip your doses that you feel withdrawal from it. And the best thing to do is to talk with your doctor about how to safely manage a plan to reduce your drinking. The good news is that if that's well managed, that you actually can adjust to a lower level of drinking pretty readily, right? Now, some people need more intensive kinds of intervention in order to psychologically adjust to not drinking. And this is partly because usually heavy drinkers don't have a good repertoire of coping strategies to deal with life. And so when you don't drink, you've got to replace the thing you were reaching for to try to cope, because you have to cope, right? Life is challenging. You know this already. So in any case, I made this video because this is a common issue, and it's a common issue with my clients who show up for therapy. And if you're watching my channel and you're interested in wellness techniques and self-help techniques and things that can help you thrive, you could be someone who has a pattern of excessive use of alcohol in an attempt to deal with your stress. And I'm just saying, I have yet to meet someone where I thought that that was a good idea, because it just doesn't work out, right? Again, a low amount of alcohol use is fine, and it's not particularly associated with any bad risks or toxicity. In general, we say 2 or less drinks per day and 14 or less drinks per week. So not more than 2 on any given day, not more than 14 a week. If you're going to drink, people in that category usually aren't experiencing much of these effects, but it's when people allow themselves to go to 3 drinks a day and 4 drinks a day and 5 drinks a day, that's when you start getting into trouble. And you know if this is true for you because you know how much you're drinking, regardless of whether you're hiding it and sharing it with anybody else, right? That's the reality. So hopefully this is helpful for you. If you have yet to subscribe to my channel, please subscribe. If you like this kind of content, please hit the like button below, and I will see you in a future video.